Collecting subjective data is a key step in nursing health assessment. This allows us to collect information or subjective data that is only elicited or verified by the client. These are subjective informations that helps us to describe what they feel, like pain, discomfort, or discrepancies in their body functions. Interviewing is the means by which subjective data are gathered. There are 4 different phases of an interview. These are the pre-introductory phase, where we review the medical record of our patient before meeting with them. Knowing the previously recorded details about our patient could help and assist us with conducting the interview, and it may reveal additional information about them. The introductory phase. The primary concern for the nurse in this phase is to find out what kind of help the patient needs. This forms the nursing assessment that helps the nurse in focusing on the patient's problem. Next, the working phase. This phase begins when the nurse and client work together to solve the problems and accomplish goals. In this phase, the nurse helps the client with self-exploration, encourage the client to set goals, and plan the actions to meet the goals set with the client. Lastly, the summary and the closing phase. The nurse summarizes information obtained during the working phase and validates problems and goals with the client. Now in this case, the nurse also makes sure to ask if anything else concerned with the client or if there are any further questions involved. Techniques in communication. Factors affecting the communication. First one is therapeutic communication techniques. This is used to engage clients with verbalizing emotions, establishing goals, and discussing coping strategies. Some of these are acceptance, clarification, and focusing. Next are the non-therapeutic techniques. Nurses must be aware of potential barriers to communication and avoid non-therapeutic responses. Non-verbal communication such as looking at one's watch, crossing arms across one's chest, or not active listening may be perceived as barriers to communication. Through this, non-therapeutic verbal responses often block clients' communication of feelings or ideas. Others are asking personal questions, giving personal opinions, and changing the subject. One must also consider the following. First is gerontologic variations or the age, cultural variations, language barriers, and emotional variations, including the current body status of the patient. For better communication, one must have a professional appearance, a good demeanor, a neutral facial expression, a non-judgmental attitude, silence, and a person who is responsible for active listening.
Sir, ano pong purpose ng pagpunta niyo dito? So, kailan po nag-start?
Kanina umaga lang sir.
Okay, sir, tatanong ko po, sa scale of 1 to 10 po, 1 being the lowest and 10 being the highest, gaano po kasakit?
Survey po.
Thank you po.
So, Sir Rico, tatanungin ko lang po yung nararamdaman nyo, yung sakit na nararamdaman nyo. Dull po ba, mild, severe, or may kumikirot po ba, or ano? So, saan po part, sir?
Dito po banda.
So, confirm ko lang, sir, sa upper left po ng chan nyo. So, ulitin po ulit, sir, kumikirot po yung left part po ng chan nyo po.
Babalikan ko na lang po kayo ulit mamaya after ko po magbigay kay Doc.
Ano pa nararamdaman, aside po sa headache, ano pa po ba ma'am?
Wala naman.
Wala naman po ma'am. Okay. Kailan po ba nagsimula yung pain niyo po ma'am?
Kahapon po.
Kahapon?
Mga 5 po, sir.
Mga 5 po ma'am. Okay po ma'am. Ma'am, ask ko lang din po sana if yung sakit niyo po ma'am.
Ma'am?
Ma'am? The following behaviors or scenarios that you have just witnessed are just few of the things that we should avoid as a student nurse, or a nurse rather.
such as excessive eye viewing, rushing creative view, distance, and distraction. And lastly, this.
Hindi naman po masakit ulo niya, no?
Hindi naman.
Hindi rin naman po kayo nahihilo, hindi rin po kayo nagsusuka.
Hindi din po.
This is BSN 1B, reminding you to always be mindful and responsible nurse.